My name is Vishwa. I'm a physiotherapist from India. Today we are going to talk about nitric oxide, which is produced by our body and its importance on our health. Do you know why it is important for our health? I'll tell you. As age passes, we reduce around 85% of the production of nitric oxide, which means deficiency of nitric oxide, and this deficiency can lead to stroke, heart disease or dementia. So today we are going to talk about the production of nitric oxide. So it is mainly released from endothelium, which is the inner layer of the vessels. It is also released from paranasal sinuses. There are 4 paranasal sinuses. First is maxillary sinus, second is sphenoid sinus, third is ethmoid sinus, and fourth is frontal sinus. So in these sinuses, the nitric oxide will be in concentrated form. So this nitric oxide will keep the sinuses relatively still, and thus it causes local host defense from the bacteria. If we talk about nasal cavity, then there are many minute hair-like structures present on the roof and side walls of nasal cavity, and they are called cilia. So now what is the relation between cilia and nitric oxide? As we all know that nitric oxide is mainly produced in exhaled air, which means the movement of cilia will cause the mucus to transform from deep respiration to up, and through sneezing and coughing we can remove that bacteria and that mucus out of our nasal cavity, and this activity of cilia will be stimulated by the action of nitric oxide. Now we will see the production of nitric oxide in nasal breathing. So whenever we do nasal breathing, it will release nitric oxide. Nitric oxide is vasodilator, which means that it will cause dilation of our blood vessels, which ultimately result into expansion of the blood vessels. Thus, there will be increase in oxygen flow in our body. Now, you must be wondering that what is this nasal breathing? It is a simple breathing technique in which we inhale and exhale through our nose by keeping our mouth closed. Now, I'll show you this technique. So, you have to sit in relaxed position and you have to breathe in through your nose and again breathe out through your nose only. So here I am not using my mouth at all. Now we will talk about the production of nitric oxide in humming. So when we are doing this humming technique, at that time there will be oscillation or vibration of our vocal cord, which will increase the exchange of nitric oxide from sinus to nasal cavity. Inhalation through nose during humming is very important to gain maximum respiratory benefit. So if you are suffering from sinusitis, then it is said that if you practice humming for 4 days, every day you have to practice this for 1 hour, then within 4 days the problem of sinusitis will be relieved. Now I will demonstrate humming technique. So this you can start with 20 minutes and then to 40 minutes. But yes, if you have sinusitis, then you can do this humming for 1 hour, and this you have to practice for 4 days. So you have to sit still and then you have to breathe in, relax, and then you have to produce this sound. So this sound you can start with low pitch and then gradually in between you can increase the pitch and decrease the pitch. When you are doing this humming technique, at that time you have to make sure that you breathe in through your nose, and yes, you have to hold each and every hum minimum for 5 to 10 seconds. Gradually you increase the duration. So the other technique of humming is you can use your thumbs. You have to keep on the ears and you have to close it, and then this 4 fingers you have to keep on all the paranasal sinuses. So you have to keep the fingers like this, and then you have to do the humming technique. Again you have to breathe in through your nose, close the ears, and then you have to do the humming. So like this, fingers like this, and then breathe in, hum. So when you are performing this technique, at that time you should feel the vibrations on your face. Nasal nitric oxide levels increase greatly during humming compared to silent exhalation, as you all can clearly see in this graph. In conclusion, humming results in a large increase in nasal nitric oxide, which is caused by a rapid gas exchange in the paranasal sinuses. Apart from this, our tongue also plays a major role in production of nitric oxide. So on the tongue there will be many nitrate molecules. So these nitrate molecules get transformed into nitrites, and from nitrites it will transform into nitric oxide. The main importance of this nitric oxide that as it is a vasodilator, so it will help to dilate and constrict our blood vessels, and ultimately it will control our blood pressure, and it will also help to prevent any heart diseases. So yes, that's it for the video. I hope you liked the video and got some information about nitric oxide. Thank you so much for watching this video.